Medical Assistant Exam Scope of Practice Questions. Question 1. At the start of care in a clinical skills review, the assistant is checking the electrocardiogram standardization mark. Which setting is commonly expected? Option A, 100 mm per millivolt. Option B, 1 mm per millivolt. Option C, 10 mm per millivolt. Option D, 25 mm per millivolt. The correct answer is option C, 10 mm per millivolt. Standard electrocardiogram calibration is commonly 10 mm per millivolt. That value would greatly exaggerate waveform size. That calibration would make complexes appear too small for standard interpretation. That value is not the common standard amplitude calibration. Question 2. While working in a primary care office, the P wave is reviewed on an electrocardiogram. Which event does it represent? Option A, atrial depolarization. Option B, kidney filtration. Option C, ventricular depolarization. Option D, ventricular repolarization. The correct answer is option A, atrial depolarization. The P wave represents electrical activation of the atria. Kidney filtration is unrelated to electrocardiogram waveforms. Ventricular depolarization is represented mainly by the QRS complex. Ventricular repolarization is represented by the T wave. Question 3. The care team in a procedure setup asks for guidance because a patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A. The machine draws blood through the wires. Option B. The test records electrical activity and does not deliver a shock. Option C. The test shocks every patient to start the heart. Option D. The electrodes inject medication. The correct answer is option B. The test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. Electrocardiogram leads do not collect blood. A standard electrocardiogram does not deliver electrical therapy. Electrodes record signals and do not inject medication. Question 4. At the start of care in a primary care office, a patient asks for a diagnosis based on symptoms described during intake. Which response is appropriate? Option A, ignore the symptoms because they are subjective. Option B, document the symptoms and tell the patient the provider will evaluate them. Option C, give a diagnosis to save time. Option D, tell the patient to search the internet for a diagnosis. The correct answer is option B, document the symptoms and tell the patient the provider will evaluate them. Medical assistants collect information and support workflow, while diagnosis is the provider's responsibility. Reported symptoms are relevant and should be documented. Diagnosing is outside the medical assistant scope. Unguided self-diagnosis can be inaccurate and unsafe. Question 5. Before the visit continues in a patient education session, a medical assistant leaves a computer screen open with patient information visible. Which safeguard would help prevent this issue? Option A, keep the screen facing the waiting room. Option B, share passwords with trusted co-workers. Option C, lock the workstation before stepping away. Option D, disable audit trails to speed workflow. The correct answer is option C, lock the workstation before stepping away. Locking the workstation protects electronic protected health information from unauthorized viewing. Visible screens increase privacy risk. Shared passwords weaken accountability and violate security practices. Audit trails support security monitoring and should not be disabled by staff. Question 6. While working in a patient education session, a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A, skip technique instructions because home cuffs are automatic. Option B, record readings with date, time, and relevant notes as directed. Option C, write only the highest number ever measured. Option D, use another person's readings if the cuff is shared. The correct answer is option B, record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Proper positioning and technique still matter with automatic cuffs. Selective recording can mislead clinical decisions. Readings must belong to the patient. Question 7. Before the visit continues in an exam room, a chemistry panel requiring plasma is ordered and the facility uses heparin tubes. Which tube color is commonly associated? Option A, green tube. Option B, gray tube. Option C, lavender tube. Option D, light blue tube. The correct answer is option A, green tube. Green tubes commonly contain heparin and are used for certain plasma chemistry tests. Gray tubes are often used for glucose-related testing depending on protocol. Lavender EDTA is typically used for hematology testing. Light blue citrate is used for coagulation testing. Question 8. As part of exam preparation in a treatment room, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A, follow emergency triage protocol immediately. Option B, tell the patient to send an email later. Option C, give a diagnosis over the phone. Option D, schedule the patient for next month. The correct answer is option A, follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Potential emergencies require immediate action. Medical assistants should not diagnose the cause of symptoms. Routine scheduling can delay care for potentially serious symptoms. Question 9. For a patient encounter in a treatment room, the prefix hyper appears in a term such as hyperglycemia. Which meaning is correct? Option A, between. Option B, below normal. Option C, above normal or excessive. Option D, around. The correct answer is option C, above normal or excessive. Hyper means excessive or above normal, as in high blood glucose. Between is indicated by inter. Below normal is indicated by hypo. Around is indicated by peri. Question 10. To protect safety in an internal medicine office, a student asks which blood component helps with clotting. Which answer is correct? Option A, platelets. Option B, alveoli. Option C, neurons. Option D, plasma glucose. The correct answer is option A, platelets. Platelets help form clots and support hemostasis. Alveoli are lung structures involved in gas exchange. Neurons transmit nerve signals and are not blood clotting cells. Glucose is a blood sugar and does not form clots. Question 11. The care team in a telephone triage workflow asks for guidance because a patient makes a complaint about care received in the office. Which response is most professional? Option A, post the complaint online for staff opinions. Option B, delete documentation related to the complaint. Option C, argue until the patient stops complaining. Option D, listen respectfully and follow the office complaint process. The correct answer is option D, listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Publicly sharing patient concerns can violate confidentiality. Destroying or altering records is unethical and may be illegal. Arguing escalates conflict and is unprofessional. Question 12. Before the visit continues in a patient intake station, a patient asks for printed medication instructions. Which practice improves health literacy? Option A, tell the patient to search online without guidance. Option B, use clear language and review the key points with the patient. Option C, provide instructions in the wrong language. Option D, use only complex medical terminology. The correct answer is option B, use clear language and review the key points with the patient. Plain language and review help patients understand and follow instructions. Unguided online searching may provide inaccurate or confusing information. Language mismatch can prevent safe understanding. Complex terms can reduce comprehension. Question 13. Following office protocol in a specialty referral visit, coordination of benefits is needed. Which situation does this usually involve? Option A, a provider orders a throat swab. Option B, a patient has more than one insurance plan. Option C, a patient needs a sterile dressing. Option D, a patient has one cash payment only. The correct answer is option B, a patient has more than one insurance plan. Coordination of benefits determines how multiple plans share payment responsibility. A throat swab order does not itself involve multiple insurance plans. Dressing supplies do not create coordination of benefits by themselves. One cash payment does not require multiple plan coordination. Question 14. Given the workflow in a same-day appointment, a patient has an irregular pulse during routine vital signs. Which measurement method is most appropriate? Option A, skip the pulse and record not available. Option B, use the patient's previous pulse from the chart. Option C, count the pulse for a full 60 seconds. Option D, count for 10 seconds and multiply by 6. The correct answer is option C, count the pulse for a full 60 seconds. An irregular rhythm requires a full minute count to improve accuracy. The findings should be measured and reported rather than skipped. Old values do not represent the current clinical status. Short counts are less reliable when the rhythm is irregular. Question 15. Before the visit continues in a telephone triage workflow, a medical assistant discusses a patient's diagnosis in a crowded elevator. Which rule is being violated? Option A, prior authorization. Option B, sterile technique. Option C, chain of custody. Option D, patient confidentiality. The correct answer is option D, patient confidentiality. Discussing identifiable health information in a public area can expose confidential information. Prior authorization concerns payer approval for services. Sterile technique concerns preventing contamination during procedures. Chain of custody concerns specimen handling documentation, not public conversations. Question 16. When a patient encounter unfolds in an internal medicine office, an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A, 4. Option B, PA. Option C, IM. Option D, subcut. The correct answer is option B, PA. PA means by mouth and is used for oral administration. 4 means intravenous and refers to administration into a vein. IM means intramuscular and refers to injection into muscle. Subcut means subcutaneous and refers to injection into tissue under the skin. Question 17. At the start of care in a community health clinic, a patient wants information released to a spouse. Which documentation is usually needed? Option A, a valid authorization or permission according to office policy. Option B, no documentation because spouses always have full access. Option C, a verbal request from the spouse only. Option D, a note written by the assistant after the fact. The correct answer is option A, a valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. Relationship alone does not automatically grant full access to records. The spouse's request alone may not authorize release. Authorization should come from the patient or legal authority. Question 18. While working in a phlebotomy station, a subpoena for medical records arrives at the office. Which response is best? Option A, ignore it because subpoenas never apply to clinics. Option B, immediately fax the entire chart without review. Option C, ask the receptionist to summarize the chart from memory. Option D, give it to the provider or designated privacy officer for proper handling. The correct answer is option D, give it to the provider or designated privacy officer for proper handling. Legal requests for records should be reviewed through office policy before information is released. Subpoenas can require action and should not be ignored. Records should not be released without verifying legal requirements and scope. Summaries from memory are unreliable and not an appropriate legal response. Question 19. After reviewing the situation in a primary care office, a patient asks about wound care instructions after a minor procedure. Which response is best? Option A, review the provider-approved instructions and confirm understanding. Option B, tell the patient not to call if symptoms worsen. Option C, avoid documenting that instructions were given. Option D, create new instructions that contradict the provider. The correct answer is option A, review the provider-approved instructions and confirm understanding. Medical assistants can reinforce approved instructions and use teach-back to verify understanding. Patients should know when and how to seek help for concerning symptoms. Patient education should be documented according to policy. Instructions should match the provider's plan and office protocol. Question 20. As part of exam preparation in an urgent care office, a capillary puncture is needed on an adult finger. Which side is generally preferred? Option A, the little finger near the bone. Option B, the center of the thumb pad. Option C, the side of the middle or ring finger pad. Option D, the tip of the index finger. The correct answer is option C, the side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The little finger has less tissue over bone and is usually avoided. The thumb is often calloused and has a pulse, making it less preferred. The index finger is commonly used for touch and may be more sensitive or calloused. Question 21. Given the workflow in a clinical skills review, a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A. Clarify the order before proceeding. Option B. Ignore the medication order completely without communication. Option C. Ask another patient what the abbreviation means. Option D. Interpret the abbreviation however it seems most likely. The correct answer is option A. Clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. The order should be clarified rather than silently ignored. Patients are not appropriate sources for interpreting orders. Guessing can lead to serious medication errors. Question 22. As part of exam preparation in a quality control review, a coworker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A. Appropriate marketing. Option B. Quality control testing. Option C. Routine scheduling. Option D. Breach of confidentiality. The correct answer is option D. Breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Quality control relates to test system accuracy, not social media disclosure. Scheduling does not involve posting private health information publicly. Question 23. After reviewing the situation in a walk-in clinic, the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A. Count respirations while the patient is unaware of the measurement. Option B. Record the respiratory rate from the last visit. Option C. Count for 5 seconds and multiply by 12. Option D. Ask the patient to breathe as deeply as possible. The correct answer is option A. Count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Current respirations must be measured during the encounter. Very short counts are often inaccurate for respirations. Deep breathing changes the normal respiratory rate and effort. Question 24. Following office protocol in a specialty referral visit, a medication is labeled for otic use. Where should it be administered? Option A. Ear. Option B. Nose. Option C. Eye. Option D. Mouth. The correct answer is option A. Ear. Otic medications are intended for the ear. Nasal medications are administered through the nose. Eye medications are ophthalmic, not otic. Oral medications are taken by mouth. Question 25. At the start of care in a walk-in clinic, the term hematuria is reported on a laboratory result. Which finding does it indicate? Option A. Protein in the stool. Option B. Blood in the urine. Option C. Air in the lungs. Option D. Sugar in the blood. The correct answer is option B. Blood in the urine. Hematuria means blood is present in the urine. Protein in stool is not hematuria. Air in the lungs is not described by hematuria. Sugar in the blood is described by glycemia terms. Question 26. For a patient encounter in a certification exam scenario, the assistant is reviewing the function of red blood cells. Which role is most accurate? Option A. Transport oxygen. Option B. Filter lymph. Option C. Create antibodies as their main role. Option D. Produce bile. The correct answer is option A. Transport oxygen. Red blood cells contain hemoglobin, which carries oxygen to tissues. Lymph nodes filter lymph rather than red blood cells producing this function. Antibody production is associated with certain white blood cells and plasma cells. Bile is produced by the liver and stored in the gallbladder. Question 27. The care team in an outpatient laboratory asks for guidance because a claim requires the code that explains why a service was performed. Which code set is used? Option A. CPT. Option B. Place of service only. Option C. NDC only. Option D. ICD-10-CM. The correct answer is option D. ICD-10-CM. ICD-10-CM codes report diagnoses and reasons for services. CPT codes report procedures and services rather than diagnoses. Place of service identifies setting, not the medical reason for care. National drug codes identify medications and do not describe diagnoses. Question 28. Following office protocol in a specialty referral visit, an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A, abandonment. Option B, patient autonomy. Option C, respondeat superior. Option D, beneficence. The correct answer is option B, patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Abandonment involves ending care without proper notice or support. Respondeat superior concerns employer responsibility for employee actions. Beneficence means acting for the patient's good but does not override a competent refusal. Question 29. The care team in a medical office workflow asks for guidance because the assistant needs to keep provider meeting time unavailable for patient appointments. Which scheduling tool is useful? Option A, coinsurance posting. Option B, order of draw. Option C, matrix blocking. Option D, sterile field setup. The correct answer is option C, matrix blocking. Matrix blocking reserves time in the schedule for meetings, procedures, or other unavailable periods. Coinsurance posting relates to patient financial responsibility. Order of draw guides blood collection sequence. Sterile field setup supports clinical procedures, not schedule blocking. Question 30. During a same-day appointment, a medical assistant prepares to administer an injection. Which set best represents medication rights? Option A. Right patient, right medication, right dose, right route, right time, and right documentation. Option B. Right diagnosis only. Option C. Right color of vial and right storage shelf. Option D. Right insurance, right copay, right appointment, and right room. The correct answer is option A. Right patient, right medication, right dose, right route, right time, and right documentation. The medication rights are safety checks used to prevent administration errors. Diagnosis alone is not enough to confirm safe administration. Vial appearance and shelf location are not sufficient medication rights. Administrative details do not replace medication safety checks. Question 31. During a medical office workflow, a provider orders spirometry in the office. Which patient action is required? Option A. Hold both nostrils and refuse to exhale. Option B. Remove the mouthpiece before starting. Option C. Follow instructions for a strong, complete breathing maneuver. Option D. Talk continuously during the maneuver. The correct answer is option C. Follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. The test depends on controlled breathing through the device. The mouthpiece is needed to measure airflow. Talking interferes with airflow measurement. Question 32. The care team in a treatment room asks for guidance because a coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A. Open the chart if the coworker promises not to tell anyone. Option B. Share the chart because staff work in the same clinic. Option C. Deny the request because there is no job-related need to know. Option D. Print the chart and remove the patient's name only. The correct answer is option C. Deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. A promise does not create a permitted reason for access. Employment at the same clinic does not automatically authorize chart access. De-identified information must meet specific standards and curiosity is not permitted access. Question 33. When a patient encounter unfolds in a pediatric clinic, the provider asks for an instrument to examine the ear canal. Which instrument should be prepared? Option A. Speculum for pelvic exam. Option B. Otoscope. Option C. Spirometer. Option D. Ophthalmoscope. The correct answer is option B. Otoscope. An otoscope is used to inspect the ear canal and tympanic membrane. A vaginal speculum is not used to inspect the ear canal. A spirometer evaluates lung function rather than the ear. An ophthalmoscope is used to examine internal eye structures. Question 34. An office review in a telephone triage workflow shows that blood flow stops during a venipuncture after the tube begins filling. Which action is most appropriate? Option A. Gently adjust the needle position while maintaining safety. Option B. Remove the tourniquet and continue filling all tubes. Option C, probe aggressively until blood returns. Option D, label the empty tube as collected. The correct answer is option A. Gently adjust the needle position while maintaining safety. A small adjustment may restore blood flow if the bevel is against the vein wall. Without blood flow, the collection cannot continue effectively. Excessive probing can injure tissue and increase patient discomfort. A tube without the required specimen must not be labeled as completed. Question 35. During a procedure setup, multiple venipuncture tubes are ordered after blood cultures. Which tube should usually come next in the order of draw? Option A, gray fluoride oxalate tube. Option B, green heparin tube. Option C, light blue sodium citrate tube. Option D, lavender EDTA tube. The correct answer is option C, light blue sodium citrate tube. After blood cultures, the light blue citrate tube is typically collected early to protect coagulation testing accuracy. Gray tubes are generally collected near the end of the order. Green tubes usually follow serum tubes and do not come immediately after blood cultures in the standard sequence. EDTA tubes are collected later because the additive can contaminate other tubes. Question 36. At the start of care in a same-day appointment, a claim is denied because patient insurance information was outdated. Which front office process helps prevent this issue? Option A, use the oldest card in the file without asking. Option B, code every visit as preventive care. Option C, verify insurance eligibility at each visit according to policy. Option D, skip registration for returning patients forever. The correct answer is option C, verify insurance eligibility at each visit according to policy. Eligibility verification helps identify coverage changes before claims are submitted. Old cards may no longer reflect active coverage. Coding must reflect the service and documentation. Returning patients can have changed insurance or contact information. Question 37. During a busy front office, a new patient completes a health history form with several medication allergies listed. Which action should the medical assistant take next? Option A, place the form in the chart without reviewing it. Option B, verify the allergy information and enter it clearly in the medical record. Option C, ask the patient to remember only prescription allergies. Option D, remove allergies that the patient says happened many years ago. The correct answer is option B, verify the allergy information and enter it clearly in the medical record. Medication allergies must be confirmed and documented so the care team can avoid unsafe orders. Important safety information can be missed if the history is not reviewed. Allergies to over-the-counter drugs, foods, or latex may also affect care. Past reactions may still be clinically important and should not be deleted without provider direction. Question 38. When a patient encounter unfolds in a diagnostic testing area, the assistant is comparing two needle gauges. Which statement is accurate? Option A, all injections use the same gauge. Option B, a smaller gauge number indicates a larger needle diameter. Option C, gauge has no relation to needle size. Option D, a larger gauge number always means a longer needle. The correct answer is option B, a smaller gauge number indicates a larger needle diameter. Needle gauge numbers are inverse to diameter, so lower numbers are wider. Needle gauge varies by medication, route, and patient factors. Gauge specifically describes needle diameter. Gauge describes diameter, not length. Question 39. Given the workflow in a medication administration visit, lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, left arm below the clavicle. Option B, fourth intercostal space at the left sternal border. Option C, fourth intercostal space at the right sternal border. Option D, fifth intercostal space at the left midclavicular line. The correct answer is option C, fourth intercostal space at the right sternal border. V1 belongs at the fourth intercostal space on the right side of the sternum. The left arm electrode is a limb lead site, not V1. That location corresponds to V2. That location corresponds to V4 in standard placement. Question 40. For a patient encounter in a procedure setup, a minor arrives without a parent for a non-urgent visit. Which action is best? Option A, assume all minors can consent to every service. Option B, ask another patient in the waiting room to consent. Option C, follow state law and office policy for consent requirements. Option D. Refuse all care without considering exceptions. The correct answer is option C. Follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction, so policy must be followed. Minor consent is not universal for all services. Other patients cannot provide consent for the minor. Some laws allow minors to consent for certain services. Question 41. The care team in a preventive care visit asks for guidance because a fax containing patient information must be sent to another facility. Which step reduces privacy risk? Option A. Include unrelated patient charts in the same fax. Option B. Leave the fax confirmation on a public counter. Option C. Send it to a number from memory without checking. Option D. Verify the recipient fax number before sending. The correct answer is option D. Verify the recipient fax number before sending. Verifying the destination helps prevent disclosure to the wrong recipient. Only necessary information should be disclosed. Confirmation pages may contain protected information and should be handled securely. Memory errors can lead to misdirected protected information. Question 42. When a patient encounter unfolds in a quality control review, a waived glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A. Record patient results without documenting controls. Option B. Resolve the quality control problem according to protocol. Option C. Change the patient's diagnosis to match the meter. Option D. Use the meter because patient samples are different. The correct answer is option B. Resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Quality control documentation is part of reliable testing. Medical assistants do not diagnose and should not alter clinical information to fit a device. Failed controls must be addressed before reporting patient values. Question 43. During a pediatric clinic, the assistant reinforces instructions for a Holter monitor. Which point is important? Option A. Submerge the monitor in water. Option B. Ignore the return time. Option C. Remove electrodes whenever symptoms occur. Option D. Keep a diary of symptoms and activities as instructed. The correct answer is option D. Keep a diary of symptoms and activities as instructed. A symptom and activity diary helps correlate events with the recorded rhythm. Water can damage the device and create safety risks. The monitor must be returned as scheduled for data review. Removing electrodes can interrupt recording when data are most important. Question 44. During a diagnostic testing area, a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A. Use the instruments if the package is dry. Option B. Open the package and rinse the instruments. Option C. Reprocess the instruments before use. Option D. Write a new date on the package. The correct answer is option C. Reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. A dry package alone does not override an expiration policy. Rinsing does not restore sterility. Changing the date without reprocessing is unsafe and misleading. Question 45. Following office protocol in a pediatric clinic, the assistant prepares the room for a minor sterile procedure. Which action supports patient dignity? Option A. Leave the patient uncovered until the provider arrives. Option B. Skip explanations because the patient signed in. Option C. Discuss the patient's body in the hallway. Option D. Provide appropriate draping and expose only the area being examined. The correct answer is option D. Provide appropriate draping and expose only the area being examined. Draping preserves privacy and warmth while allowing the provider access to the needed area. Unnecessary exposure reduces dignity and comfort. Patients still need respectful communication during preparation. Public discussion can violate privacy and professionalism. Question 46. After reviewing the situation in a busy front office, a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A. Poor electrode contact or patient movement. Option B. Correct limb lead placement. Option C. A properly grounded machine with still patient. Option D. A normal calibration mark only. The correct answer is option A. Poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Correct placement should reduce rather than create artifact. Good grounding and stillness reduce electrical or motion artifact. Calibration marks do not explain baseline movement during tracing. Question 47. To protect safety in a busy front office, the term otitis media is listed in the assessment. Which body area is involved? Option A, kidney. Option B, liver. Option C, stomach. Option D, middle ear. The correct answer is option D, middle ear. Otitis media refers to inflammation or infection involving the middle ear. Kidney inflammation is related to nephritis or pyelonephritis. Liver inflammation is hepatitis. Stomach inflammation is gastritis. Question 48. A medical assistant is working in an electronic health record review when a specimen must be protected from light after collection. Which handling method is appropriate? Option A, leave the specimen uncovered at the front desk. Option B, place the tube in direct sunlight to warm it. Option C, shake the specimen vigorously for 1 minute. Option D, wrap the specimen in foil or use an amber container as directed. The correct answer is option D. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Delayed or improper handling can compromise results. Sunlight can degrade light sensitive specimens. Vigorous shaking can hemolyze blood specimens. Question 49. Given the workflow in a diagnostic testing area, a patient with limited English proficiency arrives for a consent discussion. Which resource is most appropriate? Option A, speak louder and slower in English only. Option B, skip the explanation if the patient nods. Option C, ask a young child to interpret. Option D, use a qualified medical interpreter. The correct answer is option D, use a qualified medical interpreter. A qualified interpreter improves accuracy, confidentiality, and informed communication. Volume does not remove a language barrier. Nodding does not prove understanding or valid communication. Children should not be used for medical interpretation because accuracy and family dynamics are concerns. Question 50. When a patient encounter unfolds in a medical office workflow, the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A, the reading may be inaccurate. Option B, the patient will automatically faint. Option C, the pulse oximeter will stop working. Option D, the oral temperature will decrease. The correct answer is option A, the reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Blood pressure cuff alignment does not control the pulse oximeter. Cuff placement does not change oral temperature. Question 51. An office review in a treatment room shows that a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A, acknowledge the concern and explain the procedure in simple terms. Option B, promise that the provider will not be concerned. Option C, tell the patient the reading is probably wrong. Option D, ignore the anxiety to avoid making it worse. The correct answer is option A. Acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Promising an outcome goes beyond the assistant role and may be inaccurate. Dismissing the result can reduce confidence and may be clinically misleading. Ignoring patient concerns can increase anxiety and weaken communication. Question 52. At the start of care in a cardiology practice, a patient asks the assistant whether to stop taking a prescribed medication. Which response is appropriate? Option A, refer the question to the provider. Option B, tell the patient to stop immediately. Option C, recommend doubling the dose instead. Option D, suggest using a friend's medication. The correct answer is option A. Refer the question to the provider. Medication changes require provider guidance because stopping therapy can be unsafe. Directing medication discontinuation is outside the assistant role. Changing a dose without provider order is unsafe and outside scope. Sharing medication is unsafe and inappropriate. Question 53. At the start of care in a busy front office, the provider asks the assistant to prepare for a visual acuity test. Which tool is commonly used? Option A, Snellen chart. Option B, hemostat. Option C, tourniquet. Option D, autoclave tape. The correct answer is option A, Snellen chart. A Snellen chart is used to screen distance visual acuity. A hemostat clamps tissue or small objects during procedures. A tourniquet helps locate veins for blood collection. Autoclave tape indicates exposure to sterilization conditions. Question 54. At the start of care in a community health clinic, a patient says they cannot afford a prescribed medication. Which response is best? Option A, notify the provider or appropriate staff so alternatives can be discussed. Option B, ignore the comment because finances are private. Option C, suggest sharing medication with a friend. Option D, tell the patient to stop all medications. The correct answer is option A, notify the provider or appropriate staff so alternatives can be discussed. Cost concerns affect adherence and should be routed to the care team for appropriate options. The concern directly affects care and should be addressed respectfully. Sharing prescriptions is unsafe and inappropriate. Stopping medication without provider guidance can be unsafe. Question 55. Before the visit continues in a medication administration visit, a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A, first drops of urine into an unclean container. Option B, a random sample from an old urinal. Option C, specimen collected from the toilet bowl. Option D, clean catch midstream specimen. The correct answer is option D, clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Initial urine can carry contaminants and an unclean container is inappropriate. Old specimens may be contaminated and may not reflect current results. Toilet water contaminates the specimen. Question 56. In an administrative check-in area, a patient signs permission after the provider explains a procedure's risks, benefits, and alternatives. Which concept is demonstrated? Option A, abandonment. Option B, implied consent. Option C, battery. Option D, informed consent. The correct answer is option D, informed consent. Informed consent occurs when a patient agrees after receiving enough information to make a voluntary decision. Abandonment involves ending care without appropriate notice. Implied consent is inferred from actions such as extending an arm for a blood draw. Battery involves unauthorized touching or treatment. Question 57. Given the workflow in a family practice clinic, an exam room was used for a patient with a draining wound. Which step should be completed before the next patient enters? Option A, open the door to air out the room only. Option B, spray disinfectant and wipe it off immediately every time. Option C, clean and disinfect touched surfaces according to office protocol. Option D, change only the paper on the exam table. The correct answer is option C, clean and disinfect touched surfaces according to office protocol. Environmental cleaning reduces the chance of transferring microorganisms between patients. Ventilation alone does not remove organisms from contaminated surfaces. Disinfectants usually require the manufacturer's contact time to work properly. The exam table paper does not address other touched surfaces. Question 58. Following office protocol in a cardiology practice, muscle tremor artifact appears on an electrocardiogram tracing. Which intervention may improve the tracing? Option A, help the patient relax and support the limbs. Option B, place the paper speed at 0. Option C, ask the patient to tense all muscles. Option D, remove all electrodes during the recording. The correct answer is option A, help the patient relax and support the limbs. Muscle tension and movement can create artifact, so comfort and support may improve tracing quality. Paper movement is needed to record the waveform. Tensing muscles increases electrical artifact. Electrodes are required to capture the tracing. Question 59. Given the workflow in a medical office workflow, a patient asks the medical assistant to interpret laboratory results. Which response is within scope? Option A, post the result publicly so others can comment. Option B, tell the patient the provider will review and explain the results. Option C, diagnose the patient based on abnormal values. Option D, change the results so it appears normal. The correct answer is option B, tell the patient the provider will review and explain the results. Interpreting results and giving diagnostic meaning are provider responsibilities. Public disclosure violates confidentiality and professionalism. Diagnosis is outside the medical assistant scope of practice. Changing results is unethical and falsifies the record. Question 60. Before the visit continues in a treatment room, a centrifuge is used in the laboratory. Which safety practice is important? Option A. Open the lid while it is spinning. Option B. Place only one tube at any weight in the rotor. Option C. Balance tubes before starting the centrifuge. Option D. Stop the rotor with a hand. The correct answer is option C. Balance tubes before starting the centrifuge. Balancing tubes helps prevent vibration, breakage, and equipment damage. Opening a spinning centrifuge is unsafe. Unbalanced loads can damage the machine or specimens. Stopping a rotor manually is dangerous. Question 61. While working in a pediatric clinic, the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A. Axon. Option B. Ureter. Option C. Alveolus. Option D. Platelet. The correct answer is option A. Axon. An axon carries nerve impulses away from the neuron cell body. A ureter carries urine from kidney to bladder. An alveolus is a lung air sac. A platelet is a blood component involved in clotting. Question 62. Following office protocol in a clinical skills review, a multi-dose vial has no date after being opened. Which action is most appropriate? Option A. Guess the opening date from memory. Option B. Use it because the cap is still attached. Option C. Follow facility policy and do not use it if safety cannot be verified. Option D. Mix it with another vial to avoid waste. The correct answer is option C. Follow facility policy and do not use it if safety cannot be verified. Opened multi-dose vials require proper dating and storage to support medication safety. Guessing creates unsafe documentation. The cap does not prove when the vial was opened or whether it was stored correctly. Combining vials can contaminate medication and is not appropriate. Question 63. An office review in a medication administration visit shows that a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A. Using sterile forceps for sterile supplies. Option B. Keeping sterile items above waist level. Option C. Reaching across the sterile field with an unsterile sleeve. Option D. Opening the wrapper away from the body first. The correct answer is option C. Reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile forceps can help maintain asepsis when used correctly. Sterile items are generally kept in view and above waist level. Opening the far flap first is a common way to avoid reaching over the field. Question 64. For a patient encounter in a quality control review, a patient asks for a copy of their medical record. Which action should the assistant take? Option A. Follow the office release of information process. Option B. Delete sensitive information before the request is reviewed. Option C. Refuse because records belong only to the provider. Option D. Give the record to anyone who asks. The correct answer is option A. Follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Altering the record is inappropriate and may violate legal requirements. Patients have rights to access their health information under applicable rules. Identity and authorization must be verified before disclosure. Question 65. The care team in an infection control audit asks for guidance because the assistant removes gloves after contact with blood-contaminated gauze. Which action should follow immediately? Option A. Apply lotion instead of cleaning hands. Option B. Place the gloves in a regular drawer. Option C. Use the same gloves to clean the next room. Option D. Perform hand hygiene. The correct answer is option D. Perform hand hygiene. Hand hygiene after glove removal reduces the chance of transmitting microorganisms from contaminated gloves. Lotion does not replace hand hygiene. Used gloves are contaminated waste and should be discarded properly. Gloves are task-specific and should not be reused between patients or areas. Question 66. The care team in a clinical skills review asks for guidance because the assistant must clean instruments before sterilization. Which concept explains this requirement? Option A. Organic material can interfere with sterilization. Option B. Disinfection always destroys every spore. Option C. Sterilization is the same as hand washing. Option D. Packaging instruments makes cleaning unnecessary. The correct answer is option A. Organic material can interfere with sterilization. Cleaning removes debris so the sterilization process can contact instrument surfaces effectively. Disinfection reduces many organisms but does not reliably destroy all spores. Hand washing reduces microbes on skin but is not instrument sterilization. Packaging dirty instruments traps contamination rather than preparing them safely. Question 67. While working in an infection control audit, an insurance plan requires approval before a specialist visit. Which process is being described? Option A, autoclaving. Option B, venipuncture. Option C, prior authorization or referral process. Option D, auscultation. The correct answer is option C, prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Autoclaving sterilizes instruments and is unrelated to payer approval. Venipuncture is blood collection and does not authorize insurance coverage. Auscultation is listening to body sounds and does not approve visits. Question 68. Following office protocol in a community health clinic, the term gastroenterology appears in a referral. Which specialty is involved? Option A, endocrine glands. Option B, nervous system. Option C, urinary bladder only. Option D, digestive system. The correct answer is option D, digestive system. Gastroenterology focuses on the digestive tract and related disorders. Endocrinology focuses on hormone-producing glands. Neurology focuses on the nervous system. Urology focuses on the urinary tract and male reproductive system. Question 69. A medical assistant is working in a specialty referral visit when a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A, use latex-free supplies and clearly communicate the allergy. Option B, ignore the allergy if the procedure is short. Option C, tell the patient to bring personal gloves only. Option D, use powdered latex gloves because they are easier to put on. The correct answer is option A. Use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. Even brief latex exposure can cause a serious reaction. The clinic remains responsible for preparing a safe care environment. Latex gloves can trigger a reaction in a latex allergic patient. Question 70. As part of exam preparation in an urgent care office, a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A, battery. Option B, defamation. Option C, coordination of benefits. Option D, emancipation. The correct answer is option A, battery. Battery can involve intentional touching or treatment without consent. Defamation involves false statements that harm reputation. Coordination of benefits is an insurance concept. Emancipation relates to a minor's legal independence. Question 71. In a telephone triage workflow, the suffix ectomy appears in a procedure term. Which meaning is most accurate? Option A, visual examination. Option B, surgical removal. Option C, inflammation. Option D, abnormal softening. The correct answer is option B, surgical removal. Ectomy means surgical removal of a structure. Visual examination is often indicated by scopy. Inflammation is indicated by itis. Abnormal softening is indicated by malacia. Question 72. At the start of care in a quality control review, the office schedules several patients at the start of each hour and sees them as rooms open. Which scheduling method is being used? Option A, wave scheduling. Option B, stream scheduling. Option C, prior authorization. Option D, matrix blocking. The correct answer is option A, wave scheduling. Wave scheduling brings patients in at set intervals such as the start of an hour. Stream scheduling assigns patients specific individual appointment times. Prior authorization is payer approval and is not a scheduling method. Matrix blocking reserves time unavailable for patient appointments. Question 73. In an urgent care office, a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A, assault. Option B, coinsurance. Option C, beneficence. Option D, abandonment. The correct answer is option D, abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Coinsurance is a payment-sharing insurance term. Beneficence means acting for the patient's good. Question 74. While working in a patient education session, a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A. Administer the medication because it was ordered. Option B. Ask the patient to sign a form and give it anyway. Option C. Change the medication to another drug independently. Option D. Hold the medication and notify the provider. The correct answer is option D. Hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. An order does not override a possible allergy. A form does not make an unsafe medication appropriate. Medical assistants do not independently substitute medications. Question 75. To protect safety in a busy front office, a staff member shares an electronic health record password to save time. Which risk is created? Option A. Automatic insurance approval. Option B. Loss of accountability for chart access. Option C. Better sterilization monitoring. Option D. Improved privacy protection. The correct answer is option B. Loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Passwords do not control payer authorization. Login credentials do not sterilize instruments. Password sharing weakens privacy and security. Question 76. After reviewing the situation in a walk-in clinic, the assistant reviews the normal pacemaker of the heart. Which structure is identified? Option A. Ureter. Option B. Gallbladder. Option C. Sinoatrial node. Option D. Alveolus. The correct answer is option C. Sinoatrial node. The sinoatrial node normally initiates the heart's electrical impulse. A ureter carries urine from kidney to bladder. The gallbladder stores bile and is not cardiac conduction tissue. An alveolus is a lung air sac. Question 77. At the start of care in a same-day appointment, a prothrombin time test is ordered. Which tube should be selected? Option A. Light blue tube. Option B. Gray tube. Option C. Lavender tube. Option D. A blood culture bottle only. The correct answer is option A. Light blue tube. Coagulation tests such as prothrombin time require sodium citrate in a light blue tube. Gray fluoride oxalate is not the standard additive for coagulation studies. Lavender EDTA is used for hematology and can interfere with coagulation testing. Blood cultures detect microorganisms and are not used for prothrombin time testing. Question 78. Before the visit continues in a clinical skills review, a used needle must be discarded after an injection. Which practice is safest? Option A. Activate the safety device and place the needle in a sharps container. Option B. Recap the needle with both hands. Option C. Carry the needle to the front desk for disposal. Option D. Place the needle in regular trash. The correct answer is option A. Activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Two-handed recapping increases needle stick risk. Transporting exposed sharps through the office increases risk. Sharps can injure staff and must not go into regular trash. Question 79. The care team in a telephone triage workflow asks for guidance because an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A. Begin CPR and use the automated external defibrillator as directed. Option B. Wait for the provider before starting any response. Option C. Use the defibrillator on a conscious patient asking questions. Option D. Give oral medication before checking responsiveness. The correct answer is option A. Begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. Delaying basic life support can reduce survival. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Oral medication is unsafe when cardiac arrest is suspected. Question 80. Given the workflow in an outpatient laboratory, a claim requires the code for an office visit procedure or service. Which code set is used? Option A. ICD-10-CM. Option B. Policy number. Option C. CPT. Option D. Zip code. The correct answer is option C, CPT. CPT codes describe medical procedures and professional services. ICD-10-CM codes describe diagnoses and reasons for services. A policy number identifies insurance coverage and does not describe the service. A zip code identifies location and is not a procedure code. Question 81. As part of exam preparation in a certification exam scenario, a complete blood count is ordered. Which tube is most commonly used? Option A, red tube with no anticoagulant. Option B, light blue tube with sodium citrate. Option C, gray tube with fluoride oxalate. Option D, lavender tube with EDTA. The correct answer is option D, lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. A red tube allows clotting and is not the standard choice for a complete blood count. Sodium citrate is used mainly for coagulation studies. Gray tubes are used for tests such as glucose or lactate depending on protocol. Question 82. For a patient encounter in a quality control review, a patient has an advance directive in the chart. Which statement is most accurate? Option A. It communicates the patient's wishes about future medical care. Option B. It replaces all insurance forms. Option C. It is used only to schedule appointments. Option D. It allows the assistant to ignore provider orders. The correct answer is option A. It communicates the patient's wishes about future medical care. An advance directive helps guide care decisions if the patient cannot speak for themselves. Advance directives do not replace billing or insurance documents. Scheduling is unrelated to the purpose of an advance directive. Care decisions still follow legal, clinical, and facility processes. Question 83. An office review in an internal medicine office shows that the provider asks the assistant to perform a task prohibited by state law. Which action is appropriate? Option A. Clarify the concern and follow legal scope of practice requirements. Option B. Perform it because any provider request is automatically legal. Option C. Ask another assistant to do it secretly. Option D. Document that the patient requested it and proceed. The correct answer is option A. Clarify the concern and follow legal scope of practice requirements. Medical assistants must follow laws, regulations, and employer policy even when working under delegation. Delegation does not make a prohibited task legal. Passing on an improper task does not resolve the legal issue. Patient request does not override scope of practice limits. Question 84. In a walk-in clinic, a patient has chest hair that prevents electrodes from adhering. Which action is most appropriate? Option A. Prepare the skin according to protocol to improve electrode contact. Option B. Place electrodes over clothing. Option C. Wet the electrodes with tap water only. Option D. Ignore loose electrodes if the tracing prints. The correct answer is option A. Prepare the skin according to protocol to improve electrode contact. Good skin preparation helps electrodes adhere and improves tracing quality. Electrodes must contact skin to record electrical activity. Unapproved moisture does not replace proper skin preparation. Loose electrodes can create artifact and poor quality results. Question 85. A medical assistant is working in a clinical skills review when a pregnancy test performed in the office is classified as waived testing. Which requirement still applies? Option A. Follow manufacturer instructions and quality control policy. Option B. Skip controls because waived means unregulated. Option C. Use expired kits if the package is unopened. Option D. Report results before the test develops. The correct answer is option A. Follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Waived status does not eliminate quality responsibilities. Expired test kits may give unreliable results. Reading before the correct time can produce inaccurate results. Question 86. Before the visit continues in a cardiology practice, a chain of custody urine drug screen is collected. Which practice is most important? Option A. Allow the patient to take the specimen home first. Option B. Skip signatures if the specimen looks normal. Option C. Document each transfer and maintain specimen integrity. Option D. Use an unlabeled container until the lab receives it. The correct answer is option C. Document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Uncontrolled possession breaks specimen integrity. Appearance does not replace custody documentation. Unlabeled specimens can be rejected and cannot be reliably traced. Question 87. The care team in a women's health clinic asks for guidance because an intramuscular injection is ordered for an adult. Which site may be used according to protocol? Option A. The fingernail bed. Option B. A reddened rash site. Option C. Inside a visible vein. Option D. Deltoid muscle when the medication and volume are appropriate. The correct answer is option D. Deltoid muscle when the medication and volume are appropriate. The deltoid can be used for certain adult intramuscular injections when volume and medication are suitable. The fingernail bed is not an intramuscular injection site. Irritated or infected skin should generally be avoided. A vein is used for intravenous access, not intramuscular injection. Question 88. During a walk-in clinic, the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A. Store it in a desk drawer overnight. Option B. Use it after expiration if it looks clear. Option C. Place it in direct sunlight to warm quickly. Option D. Maintain required temperature storage and check expiration before use. The correct answer is option D. Maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Room temperature storage can damage refrigerated products. Appearance does not prove potency after expiration. Sunlight and heat can damage the product. Question 89. As part of exam preparation in a busy front office, the provider is running behind and a patient asks for an update. Which response is professional? Option A. Discuss another patient's emergency as the reason. Option B. Tell the patient that waiting is their only option. Option C. Apologize for the delay and provide the best available estimate. Option D. Guarantee an exact time even when it is unknown. The correct answer is option C. Apologize for the delay and provide the best available estimate. Clear and courteous updates help manage expectations without blaming others. Sharing another patient's situation can violate privacy. Dismissive communication is unprofessional. False certainty can create more frustration. Question 90. For a patient encounter in an electronic health record review, the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A. Inflammation of the liver. Option B. High blood sugar. Option C. Fast breathing. Option D. Slow heart rate. The correct answer is option D. Slow heart rate. The prefix brady means slow, and cardia refers to the heart. Inflammation of the liver is hepatitis. High blood sugar is hyperglycemia. Fast breathing is tachypnea rather than bradycardia. Question 91. As part of exam preparation in a telephone triage workflow, a sterile dressing change is being prepared. Which action helps maintain sterility? Option A. Open sterile supplies without touching the inner sterile surface. Option B. Place sterile gauze on an unclean counter. Option C. Reuse sterile gloves from a previous patient. Option D. Reach across the field with unsterile clothing. The correct answer is option A. Open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. An unclean surface contaminates sterile supplies. Sterile gloves are single-use and patient-specific. Reaching over the field can contaminate it. Question 92. After reviewing the situation in a clinical skills review, a voicemail must be left for a patient according to office policy. Which message is safest? Option A. Describe the diagnosis in detail on the message. Option B. Leave limited information and a callback number. Option C. Leave another patient's results for comparison. Option D. Demand payment details with full medical history. The correct answer is option B. Leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Detailed clinical information may be heard by unauthorized people. Sharing another patient's information is a privacy breach. Excessive information violates privacy and may not be necessary. Question 93. Following office protocol in an administrative check-in area, the term cardiology appears in a referral. Which specialty is involved? Option A. Skin disorders. Option B. Digestive disorders. Option C, heart and cardiovascular system. Option D, kidney disorders. The correct answer is option C, heart and cardiovascular system. Cardiology focuses on the heart and cardiovascular system. Dermatology focuses on the skin. Gastroenterology focuses on the digestive system. Nephrology focuses on the kidneys. Question 94. Given the workflow in an infection control audit, a patient feels faint during a blood draw. Which response should occur first? Option A, stop the procedure and protect the patient from injury. Option B, tell the patient to stand up quickly. Option C, leave the patient alone to find paperwork. Option D, finish filling the tube before responding. The correct answer is option A, stop the procedure and protect the patient from injury. Safety comes first when a patient shows signs of syncope during venipuncture. Standing can worsen faintness and lead to a fall. A faint patient should not be left unattended. Continuing the draw can worsen the situation and increase injury risk. Question 95. At the start of care in an exam room, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A, demographics, contact information, insurance information, and reason for visit. Option B, the assistant's diagnosis before the visit. Option C, only the patient's favorite pharmacy color. Option D, another patient's insurance card. The correct answer is option A, demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. The assistant should not diagnose during scheduling. That information does not complete registration. Insurance information must belong to the patient being registered. Question 96. Before the visit continues in a clinical skills review, a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A, tell the patient dizziness is impossible. Option B, assist the patient to sit or lie down safely. Option C, leave the patient standing while searching for forms. Option D, ask the patient to walk faster. The correct answer is option B, assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. Dismissing symptoms does not protect patient safety. An unsteady patient should not be left unsupported. Walking can increase fall risk when the patient is dizzy. Question 97. When a patient encounter unfolds in a family practice clinic, the assistant identifies an abnormal rhythm on a tracing after it prints. Which action is within the medical assistant role? Option A, change the tracing to make it look normal. Option B, discard the tracing to avoid alarming the patient. Option C, diagnose the rhythm for the patient. Option D, give the tracing to the provider promptly according to protocol. The correct answer is option D, give the tracing to the provider promptly according to protocol. The assistant may recognize urgency and route the tracing, but interpretation belongs to qualified clinicians. Altering medical records is unethical and unsafe. Abnormal results must not be hidden or discarded. Medical assistants should not provide a cardiac diagnosis. Question 98. Following office protocol in a patient education session, the QRS complex is reviewed on an electrocardiogram. Which event does it mainly represent? Option A, lung gas exchange. Option B, ventricular filling with blood only. Option C, atrial repolarization only as the visible main event. Option D, ventricular depolarization. The correct answer is option D, ventricular depolarization. The QRS complex represents electrical activation of the ventricles. Gas exchange occurs in the alveoli, not on the QRS waveform. Mechanical filling is not the primary electrical event represented by QRS. Atrial repolarization is usually hidden within the QRS complex. Question 99. An office review in an exam room shows that a patient is crying after receiving difficult news from the provider. Which nonverbal behavior is supportive? Option A, sit at eye level and allow silence when appropriate. Option B, stand over the patient with crossed arms. Option C, keep checking messages during the conversation. Option D, laugh to lighten the mood immediately. The correct answer is option A, sit at eye level and allow silence when appropriate. Calm presence, appropriate eye level, and respectful silence can support a distressed patient. Closed posture and standing over the patient can seem intimidating. Distracted behavior suggests the patient is not being heard. Humor can be inappropriate when a patient is distressed. Question 100. As part of exam preparation in a diagnostic testing area, a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A. File the result for review at the end of the month. Option B. Notify the provider or designated clinical staff promptly. Option C. Tell the patient the exact diagnosis without provider review. Option D. Discard the result because it is abnormal. The correct answer is option B. Notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Delaying a critical result can put the patient at risk. Diagnosis and interpretation belong to the provider. Abnormal results must be reported, not discarded.